antigen effect. So increases the plasma prolactin, inhibit degradation of estradiol by liver, high dose for prolonged period of time. High dose for prolonged period of time may produces gynecomastia. What is gynecomastia? That is appearance of the female-like structure, that is enlargement of the breast and other organs. So that is known as gynecomastia. Loss of libido, decrease in the sperm counts. So it causes a decrease in the sperm count. All these are responsible for the infertility in the male. Infertility in the male, right? Now how the interaction takes place of this cimetidine? Interaction inhibits cytochrome P450. Now what is P450? It is an enzyme which is present in the liver, and this enzyme is responsible for the hydrolysis of various drugs which are hydrophobic in nature. That is, the lipid components are present in them, and this P450 is responsible to metabolize these drugs. So it inhibits cytochrome P450 isozymes and decreases the hepatic blood flow. P450 is monooxygenase. It is usually monooxygenase enzyme P450. Now it inhibits the metabolism of various drugs. The P450 inhibits the metabolism of various drugs, that is theophylline, pectoine, carbamazepine, phenobarbitones, sulfonylurea, quinidine, imipramine, lidocaine, and warfarin. These are the drugs that can be inhibited, that is the metabolism of these drugs can be inhibited by the P450. Now again, antacid reduces the absorption of all H2 blockers. The gap of 2 hours should be allowed. Now antacid reduces the absorption of all H2 blockers. When antacids are given to the patient, they blocks H2 receptors, so that's why there must be some gap between the H2 blockers and this drug. So gap of the 2 hours should be allowed. Now dose for having ulcer, that is 400 milligram PD or 800 milligram at bedtime orally. At bedtime orally. For stress ulcer, you know that the ulcer is various type of the ulcer is there. One of that is stress ulcer. Stress ulcer means whenever the patient is in the stress, there is increased secretion of the SCN. So for stress ulcer, 50 milligrams per hour by means of intravenous infusion should be given to the patient, right? So that is about the cimetidine. Next drug is ranitidine, which is known as Zantac. Now 5 times more potent than the cimetidine. 5 times more potent than the cimetidine. But up till now, that drug can be used for this peptic ulcer treatment. But nowadays, its use is banned due to causing the stomach malignancy, because there is ulceration. When the ulceration becomes severe, it converts itself into a tumor or malignancy. So the ranitidine or Zantac is responsible for this stomach malignancy. So that's why nowadays its use should be banned. Now next is the famotidine. Famotidine, which is known as having the thiazole ring in its structure, containing H2 blocker, having long duration of action. Now this is the drug which is having long duration of action, that is 5 to 8 times more potent than the ranitidine. It is again more, ranitidine is more potent to the cimetidine. Famotidine more potent than the ranitidine. So that's why we can say that famotidine is most potent drug for the treatment of the peptic ulcer, having long duration of action, that is 5 to 8 times. So low affinity for the cytochrome P450 enzyme. So that's why you know that those drugs which are immediately hydrolyzed by the specific enzyme, they are having short duration of action, and those drugs which cannot be hydrolyzed immediately by the specific enzyme, they are having long duration of action. So that's why low affinity for the cytochrome P450 enzyme. So therefore there is long duration of action. Bioavailability is 40 to 50%. Excreted by the kidney. Again, you know that excreted by the kidney. These drugs usually excreted by the kidney. So if the person is having some kidney problem or suffering from kidney failures, then these drugs should not be given to those patients, because the excretion of this drug usually takes place through the kidney. No significant adverse effect of famotidine, right? Dose is 20 milligram BD, in the form of femonate acid. 20-40 milligram tablets are available. 20-40 milligrams tablets are available. Now uses, particularly they are used for the duodenal ulcer, gastric ulcer, stress ulcer, gastritis, Zollinger-Ellison syndrome. What is Zollinger-Ellison syndrome? Zollinger-Ellison syndrome is that syndrome in which there is increased secretion of HCl takes place. That's why it is known as Zollinger-Ellison syndrome. Now, proton pump inhibitor as the drug of choice in this case. Proton pump inhibitor. Now, what do you mean by proton pump inhibitors? Proton pump inhibitors are those drugs which inhibits the secretion of hydrogen ions. So that's why they are known as proton pump inhibitors. Proton pump inhibitors are the drugs of choice. In this case, that is Zollinger-Ellison syndrome. Ultimate treatment is surgery. If this ulcer is not cured by these drugs, by these medicines, then ultimate treatment is the surgery. Now there is another disorder that is known as gastroesophageal reflux disease. Gastroesophageal reflux disease, in which there is reflexly, again there is formation of HCl takes place, that is GRD. So prophylactically these drugs should be given to the patient to inhibit this GERD. Now prophylactically they also should be given to the patient of aspiration pneumonia, that is in case of aspiration pneumonia. During surgery, anesthesia, that is during anesthesia or the surgery, there is requirement of the decreased HCl secretion. So that's why prophylactically they are given to avoid the aspiration pneumonia. To avoid the aspiration pneumonia means that entrance of this into the lungs, that is known as aspiration of pneumonia, right? Now this is again